God knows where, he was prescribed everything from antibiotics to dietary supplements. Come to me, I'll just cut it off for you. It goes inside, into the abdomen. You can feel it on yourself. What medications did I start using? So that it doesn't move anywhere, and in the legs of the penis there was also Peyronie's disease. Hello, Peyronie's disease. My dear students, I'm recording this video not only for patients, but also for students, and for those whose families have encountered this unpleasant disease. I'm going to tell you now what it is, how it's treated, how we treat Peyronie's disease, and how I see it myself. And you can find even more detailed information in another video I have, where I talk about Peyronie's disease and share my perspective based on how I studied it and my own understanding. My approach, my method is patented, and there is a separate video dedicated to this topic. Please find it and watch it. So, based on a patient who came to see me from Novorossiysk, his name is Andrei. When he palpated, when he touched his penis, it started to hurt, it began to curve, and he found a hardening there. He was treated by various doctors, God knows where, and was prescribed all sorts of medications, from antibiotics to a bunch of dietary supplements. All of this was done chaotically, because the doctor didn't have a clear understanding. One doctor even told him, "I'll treat you surgically. When the plaque there finally hardens, then come to me and I'll just cut it out for you." In short, all sorts of nonsense. Eventually, he found me on the internet and came to see me. During the ultrasound, a plaque was detected, already partially formed, and calcifications had already started to precipitate. Moreover, a plaque in the penis can be found not only in the shaft of the penis, in the shaft, right? Not everyone understands what the shaft of the penis is. There is the glans and there is the shaft. And this shaft also goes inward, into the abdomen. You can feel it yourself. If you touch your perineum from the groin area, that's exactly where these so-called legs go. And Peyronie's disease was also present in the legs of the penis. It was a very serious situation because this Peyronie's disease can sometimes even grow into the testicles and spread into the surrounding tissues. That's a pathological progression. In his case, it was all right next to a blood vessel, and he came with his wife, and I would say his wife was praying for him. And of course, yours truly as well, because I needed to stop it and even reverse those calcifications. What medications did I start using? The first thing I started working with was anti-inflammatory therapy. And I suppressed the inflammation harshly and immediately. I'll say this, I don't use shockwave therapy to suppress inflammation. I think it's absolute nonsense to use shockwave therapy to suppress inflammation. Well, in cartilage, yes, but in the penis, no. Completely different methods work perfectly well in the penis. We suppress the inflammation, that's one. Next, we resolved the chronic prostatitis, and he also had pelvic varicose disease, varicocele. We resolved that issue too, treated it. Well, not cured, but treated. We meticulously reinforced it very well, so it absolutely wouldn't move anywhere at all. And then we carefully started working directly with the plaque itself, and we effectively used a comprehensive resorptive therapy approach. Then we have a great medication. I really like it. I won't say its name, but it works just wonderfully. I'm not saying it just to advertise. It's a supportive medication. It's not the only one. It won't work as monotherapy, but as supportive therapy, it's absolutely wonderful. 2, then we used physiotherapy. We kept working, and finally we succeeded. So about a week later, I saw both a reduction in the calcifications and the plaques starting to dissolve. And the patient himself felt it with his hands. And the curvature of the penis became less pronounced. And the process began. I'm very happy, and I wish the same for you. Goodbye. All the best to you.